Steven here. I'm going to show you how to work into iliacus or Iliopsoas. And something's a little tricky sometimes, but we got to first understand kind of where we're going to. So the first spot that we want to look at is the bony point on the front of the hip is kind of the ASIS, the anterior superior iliac spine. So we can notice this little bony point on the front, and this is going to be our landmark that we're working off of. Typically when I work onto the iliacus, which is kind of part of the psoas or the shorter part of it, I'm going to work inside and slightly down and into that area. And so it's a little bit tricky sometimes, and I want to stay away from like rectus abdominis. It's pretty easy for people to move the ball all the way in, and they're then rolling on kind of rectus abdominis, or they're on their bladder, they're pushing around in this area. And really I want to stay as close to the bone as possible, and I'll show you how I have to do that. So typically laying in a prone position, I'll set up, and I'll take that ball and I'm going to look for the ASIS. I'm going to put the ball just on and slightly inside of the ASIS, so I can find that bony point. I'm just inside of it, and so I'm touching the bone the whole time because the muscle is attached to that bone. So I can start here, just laying, forehead stacked on top of two hands, and I can breathe. And I can start to let that ball sink in a little bit. Option 2, I move towards more of a sphinx pose. So I come up to the elbows underneath the shoulders, forearms can be parallel. I'm gripping the ground, I'm stabilizing my shoulder position. I'm not just dumping in here and letting everything fall. I want to keep stability through the shoulders, and I can find some ease in that iliacus. So if this is enough, then we stay here, and you might have to migrate up or down a little bit to find the spot that's going to work for you. Again, the vector, if I think about the bone, and I'm pushing kind of towards the bone it's moving outwards. So I feel like the vector is pushing slightly lateral and towards the backside of the body. So I can find this position. If this is good and I want to work a little deeper, then I tend to tuck the toes on the right side. And then on the inhale, I'm going to try to press the heel towards the wall, lifting the knee off the ground, getting a little bit more extension in the hip. On the exhale, then I can let that knee sit down. So I can work in this position using a pin and stretch, using the inhale, pressing through the heel, and the exhale, letting it settle back in. And maybe we find that end range and we want to breathe here. And maybe we find subtle movement. That's the progression I typically work in. Pretty simple, pretty easy, but if we're having low back pain, or if we have tight hip flexors from sitting all day, we have that anterior pelvic tilt, depending on what the cause is, it may be helpful to work into that iliacus, Iliopsoas. So try that one, and leave me a comment, let me know what you think.